Hello Kenneth.
Hi.
I'm Helen. I'm going to be your physiotherapist for your osteoarthritis treatment.
Okay.
And you've been referred by the other physios just for some exercise and booster sessions, is that correct? Yeah. What I'm going to do today is just explain my role to you, explain what osteoarthritis is, and then explain just some of the treatment options that we might be doing for you. Does that sound okay?
Yeah, it sounds fine.
So do you know the role of a physiotherapist already, or?
Just briefly explain that you help me.
Yeah. So the role of a physiotherapist is really just to help you get back to your normal daily activities. I know from your notes and from the other physios, they say that you really like going out for walking with your friends, you like hill walking, etc. But are you feeling like you can't do that as much now?
Yeah, I've not been able to do it at all recently.
Yeah, is that because of the pain and the stiffness in your hip?
Yeah,
it's just getting too much for you?
Mm-hmm.
No problem. What do you know about osteoarthritis already?
They just briefly explain that it's some wear and tear of the joint.
Okay, so what my real aim is today then, I'm just going to explain a little bit about the anatomy of the hip, and then about really what happens as osteoarthritis is going on in your hip. It'll really just give you a better understanding of what's happening to your body, and hopefully it'll make you aware of why we're doing the treatment and how you're going to benefit from it. Does that sound okay?
Yeah, it's fine.
Perfect. So we're just going to move on to the anatomy of the hip to begin with. So, you know, the hip, it's one of the largest joints in your body. It's what's called a ball and socket joint. So that means that the thigh bone, so if you feel your thigh bone running up to your pelvis, the top of your thigh bone, it's almost like a ball, like a head, so that's where we get the ball from. And then your pelvis shaped almost like an indent on it. So what happens is the pelvis is like this, and the ball and socket, they're just fitting together, and that's where you get the movement of the hip. Okay? So now around the ball and socket joint, you have something called articular cartilage. This cartilage really just makes it smooth, slippery movement for your hip. It means that the movement's nice and easy, you're not getting pain or stiffness, but I'm going to move on how osteoarthritis does affect this. What you have all over the joint is a fine lining called synovium, and this synovium applies synovial fluid. What this fluid does is it just lubricates the movement as well. I'm just going to show you a diagram here. So this is a diagram of a healthy hip joint versus an osteoarthritic hip joint. You can see here the healthy cartilage. There's no wear and tear of that whatsoever. But on this side, you can see some wear and tear, and I'm just going to go on about the synovial fluid. It's the black section here. You can see how it's nice and clear in the healthy hip joint. You can see a nice lining of the synovial fluid. Whereas in the osteoarthritis hip over here, you can see that it's all jagged. There's not much of it left. Okay, so really in osteoarthritis, you've got this because of repetitive stress really onto your hip. Some people can get wear and tear of their hip from a sporting injury, but it is just all the movement. You've been pretty active as a person, so that's really why it's came on. But you don't have to worry, osteoarthritis isn't a progressive disease, so it means that we can stop it in its tracks and hopefully get you back to your normal activities again. So what happens in osteoarthritis is the cracks form in the cartilage. This is caused by the bones fraying from rubbing against one another. Because the cracks in the cartilage form, the bone becomes, again you can see the bone, so the cracks in the cartilage, you can see that bone underneath the cartilage now in this picture, because the bone, you can now see it, means that bones rub against each other from the thigh bone and the pelvic bone. What happens when these rub against each other? They cause microfractures. These are just really, really tiny fractures in the bone and can really cause you that pain, stiffness and really sore when you're moving about. What the body tries to do is it tries to heal itself, which is its normal natural response. But when it does this, it lays down more bone. So because it's laying down and it's thickening the bone, it can cause you some bony spurs on your hip. Really what these are, it's just thickened bone. You can see this more prominently in, have you seen someone with arthritis of the hand before? And they look quite knobbly. So that's like the thickened knuckle, so it's the thickened bony spur of the hand. So that's really what's happening in your hip. Do you know with osteoarthritis it can cause you some longer term symptoms? I'm sure you felt them, like you can't move your hip as much, you've been getting out of bed, it's a bit stiff. And this is what's called a decreased range of movement of your hip. But what we're doing to combat this is the exercise and the booster sessions. Do you know what exercise does to to your hip, or have you been doing any exercise at all?
I've not been doing any, to be honest, because it's been sore. I wasn't sure what was...
Yeah, that's completely understandable. People tend to stay away from exercise because it is very sore. And why would you do something that puts you in more pain when you're already in pain? It's understandable. But there's so much research behind exercise. It's getting past that discomfort level to see that improvement.
Right.
And I'm going to talk to the doctors and things and the nurses to get your pain under control, to help that pain management, so we can really go on with the exercise and you'll see improvement.
Good.
Exercise, what it does is it strengthens the muscles around your hip, and if the muscles are strengthened around your hip, it stabilises your hip joint, decreasing your pain.
Okay.
But exercise has lots of other improvements it can do to your health as well, such as it can increase your morale, make you feel more energised. I know from reading your notes you're obviously struggling with a little bit of weight gain as well.
Yeah, I was worrying about that.
You're finding that a little bit of an issue because you've been so active and now you're not as active. Completely understandable that you put on a few pounds, but once you get up again, they'll drop off, not a problem. So we'll worry about that later on.
Okay.
If you don't exercise, it can increase your pain and stiffness and can cause you a lot more stress in the joints. So that's our main topic to work on.
Okay.
What I'm going to talk to you about is a little thing called self-management. Have you heard of that before?
Kind of.
Kind of. Self-management is really like where you think about the decisions that you want. So you think about the treatment that you want to do.
Right.
Then we'll talk about it. So I'll say maybe, oh, I really think these exercises will help you. You might go, oh no, I don't like those exercises very much, and we'll change it. We'll just work together to try and make a plan that suits you and suits your lifestyle.
Right.
We can also work with family members if you have close family or friends. You can get your friends involved, and they can help you and just watch that you're exercising properly and things.
Yeah.
Self-management is also really good for adherence, because I'm sure you've been to a physio before. If you've heard people going to physio, we'll give you a sheet of exercises and you say you'll do them but you never do.
No, no.
What self-management does is it really helps that adherence and helps you stick to it, and it'll just give you more control over what you want to do, because I'm sure you're feeling like you're losing control, you're not able to do the things you want to do, whereas now we'll hopefully bring that back into your life and make you a lot happier.
Good.
I'm just going to talk to you a few simple treatment methods. So self-management methods you can do at home and you can go away and do until I see you next. So I'm sure you've heard of like heat and ice before. Have you done that for anything before in your body?
I find that baths kind of help, but then I've been struggling to get in and out the bath at the moment.
So baths are really good because they apply heat. What heat does is it improves the circulation and it improves the blood flow to your muscles. This will help that local pain that you're getting around that hip. And you might find like your muscles are going into spasm, so they're getting really tight.
Right.
So what heat will do is it just relaxes that muscle spasm.
Okay.
Do you know how long to put heat on for at all? You're just whacking it on for whatever. Yep.
Yeah.
So it's usually 15 to 20 minutes holding it on. But what I can advise you to do is hot water bottle. Have you got one of them at home?
Yeah.
Yeah. So what you can do is you can fold the towel up and place the hot water bottle inside the towel and then apply it to there. I wouldn't apply the hot water bottle straight onto your skin because it might burn it. And also don't apply a hot water bottle if it's feeling quite irritated or the skin's warm already. And then the next one's ice you can do. It's also a really good one because osteoarthritis causes quite a lot of inflammation. It's one of the main symptoms of osteoarthritis in the hip. So the ice really just helps you cool down that burning pain that you're getting. And same again, it's 15 to 20 minutes. Even just grab a bag of like frozen veg or peas, wrap it in the towel again. But yet again with ice, wouldn't apply it if you're feeling cold or really stiff in the morning.
Right.
So just work between the two. But if you have any more questions at all for me like that, you can ring us up or I can make another appointment to explain it.
Well done.
And the last bit then, I said about booster sessions at the start.
Yeah.
Yeah. Have you heard of a booster session before?
Yeah, just...
You know, it's kind of just like a top-up session.
Right.
What a booster session does, it just decreases your further risks and worsening of the OA because I'll be seeing you more often.
Okay.
So it's really like just before that you don't want to go off for 6 months and not do anything. So it's really just me checking up to making sure that you're okay with everything that's going on. A booster session is really good that if the exercises are getting too easy for you that you're doing, that I can give you some harder ones, I can progress them for you. even if they're too hard for you, I can decrease them.
Right, okay.
And then if you have any questions or advice you need, or even just a little bit of motivation from one of us, it doesn't have to be from me. I can get a nurse involved or a doctor to come and talk to you, just to boost your morale a bit more.
Yeah, I'd be happy for the support.
Yeah, so really what the self-management and booster sessions does is exactly that. It gives you more support over your treatment, and it makes sure that it's beneficial for you and your progression. Does that sound okay?
Yeah, it sounds great.
Super. So